Cedars-Sinai Guerin Children has launched the first neuro NICU in the LA region. It is offering innovative care to newborns with complex neurological conditions. And Dr. Rangasamy Ramanathan is the director of neonatology at Cedars-Sinai Guerin Children. He's here to talk about this state-of-the-art medical facility that we are so lucky to have here in Southern California. I was just saying, you guys do such important work, so thank you for being with us.
Thank you so much.
Yeah, I think most people are familiar with the NICU, the Neonatal Intensive Care Unit for sick babies.
Yeah.
What is a neuro NICU?
So neuro NICU specializes in babies that has neurological problems. For example, the time of birth, they are not getting enough oxygen, not blood flow to the brain, or babies with the brain anomalies, congenital malformations of the brain, or stroke. It happens in 2 out of 1,000 babies.
Wow. And when it happens, it's a very serious issue.
It's a very serious issue, and also time. Time is very crucial for intervention. Once we suspect a baby having the diagnosis of what we call hypoxic ischemic encephalopathy, a lack of oxygen to the brain, lack of blood flow to the brain, that impacts the baby's brain, we need to start the treatment with cooling therapy. We drop the baby's temperature to 33.5 for 72 hours. It's extremely important to start the treatment within 6 hours to get the maximum benefit. If you try to, that's one of the reasons why the Guerin Children's Neuro NICU, first of its kind, not only for babies born at Cedars, but in the greater Los Angeles area.
Yeah, it's very important. It's going to have that access for babies in our region. I understand you're bringing together a bunch of different kinds of specialists. Tell us who will be working in this unit.
Absolutely. Number one, the baby doctors or
Yes, we need
neonatologists.
those.
Number two, neurologists who take care of the brain. And neuroradiology, because a lot of these babies require MRI of the brain, for example.
Okay.
And genetics. 40% of the babies with neurological problems have genetic origin. So we are one of the centers, few centers in LA that offers genetic testing of the baby, mom, and the dad.
Wow.
So once we know what the genetic makeup is or the mutation is, we can target the therapy, not just every baby that gets a convulsion, for example.
Sure.
Gets response to one anticonvulsant medication, anti-seizure medication. So if we have that, we know the results come in days, and we can target therapy, personalized therapy to the babies.
This is amazing. It sounds like a really advanced form of treatment. How is it accessible to people? How is it affordable?
How is it affordable? Any baby that is born in LA, in our center, or some referral hospital calls us, I have a baby with a neurological problem, I want to transfer the baby. We send our transport team, pick up the baby, bring the baby, and provide exactly the same care for every single baby.
That is really amazing.
Absolutely.
I'm sure this is game-changing. You told me you've been doing this for 4 decades. This is not, I'm sure, something you saw when you first started in this practice.
But things have changed dramatically in neonatal medicine, one of the few fields that technology has improved our way of monitoring these babies, brain blood flow. We have much better monitoring. We have 24/7 electroencephalography, EEG monitoring of the brain waves that tells us the baby's having seizures or not. So we targeted therapy with extensive monitoring of these babies.
Absolutely. And how do you continue to treat them if they need that treatment once they leave the unit?
Oh, we have a follow-up. Every single baby that's in the neuro NICU gets followed up by neurologists and high-risk infant development, where they get followed up, because these babies may need help for regional center help. Early intervention, for example, to get their muscle tone if there is an issue. So they get lifelong care, basically. If the baby's at Cedars, then they get referred to pediatric neurologists and any other subspecialists. Often they have comorbidities, like they may have a congenital cardiac disease.
Right,
so the cardiologist followed them. So it's a lifelong care.
Amazing.
The baby comes there, they don't have to go anywhere else. They can come to all the specialists that they need to see.
We are so glad to hear that this is in our region. Dr. Ram, thank you so much for being with us this morning and for the important work that you do.